Now, teenage pregnancy remains a major concern in South Africa. According to the Department of Health, at least 190 teenagers gave birth on New Year's Day. On Christmas Day, 145 teenagers delivered babies at various government facilities across the country. The youngest of the new mothers were the 14-year-olds from KwaZulu-Natal in the Eastern Cape. Experts have been debating whether poverty and a lack of sex education from an early age could be contributing factors to the country's high teenage pregnancy rate. To discuss this matter further, we are now joined virtually by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, and LoveLife's National Manager for Healthy Lifestyles Thabiso Mokoena. Gentlemen, very good morning to you. I hope you can hear me now. Welcome to Morning Live.
Good morning, Cynthia.
Great stuff. Thank you so much. Dr. Dhlomo, I'm going to start with you. South Africa continues to record increased rates of teenage pregnancies. Is teenage pregnancy becoming a national crisis here in the country?
Thanks, Simpiwe, and good morning to Thabiso also and to your viewers. You really recorded it well. On the Christmas Day, 145 babies from teenage mothers, and then on the New Year's Day, 190. So you can look at those figures there, and say, on average, we have about 1,500 deliveries in the country per day. Of those, about 100.
All right, Dr. Dhlomo, we seem to be losing you, but let me also engage LoveLife's National Manager for Healthy Lifestyle, Thabiso Mokoena. Thabiso, a very good morning to you. Just to pick up on where Dr. Dhlomo left off with regards to whether teenage pregnancy is becoming a national crisis in South Africa.
Good morning to yourself once again, Simpiwe, and the viewers at home. Good morning to the Deputy Minister. Indeed, there is a challenge in the country in relation to issues of teenage pregnancy, and it is becoming a serious concern, not only to an organization that is LoveLife, but to quite a number of stakeholders that are playing a role in terms of implementing intervention methods that have been put in place, both by the policymakers as well as the engagements that we on continuous basis have to ensure that this is put into the correct control. I must indicate to you, Simpiwe, that in November last year, the Human Science Research Council issued a survey that normally gets to be issued almost every 3 to 4 years, that gives a clear indication of the progress and non-progress thereof in the country in relation to HIV. And one of the issues that is stated and the outcome that is stated in the survey is that the use of condoms in the country, particularly in the ages between 15 to 24, has gone down. And this has been a trend in the past surveys. At some stage, we were sitting at about 60% for males and a higher percentage for females. But we are now sitting at about 40% for females and 50% for males in those age category. That is a serious concern and a contributing factor to what we are calling today a crisis. I don't think it is totally out of hand. There is interventions that are in place that both the department and implementing partners have put in place to ensure that this is put into control. But I think the rise is a very serious concern to ourselves, and surely it is a concern to other role players in this space.
Now, Dr. Dhlomo, I hope you can hear me now. Just picking up on what Thabiso has just said, that there is serious interventions being put in place by the policymakers. So from your perspective, what are some of these interventions? And just judging by the 14-year-olds who gave birth in KwaZulu-Natal and Eastern Cape were probably, 13 years old when they fell pregnant. Is this acceptable as a society? Should this be categorized as statutory rape?
Now, you're asking a bundle of questions, Simpiwe, but let me start by disaggregating the data. If you were to disaggregate that data, you'll show that predominantly the people who are actually getting pregnant are African girls more than any other race. So there's a problem that you need to actually say, is it actually the same in all other age groups in terms of sex education? Number two, partners with the people like LoveLife, we work into programs that we are creating youth zones, where we are saying, we have now about 1,800 youth zones in the country. Those are in clinics and hospitals where at least you got one nurse who's youth user-friendly, not judgmental, able to assist young people. Because we now have a 15-year-old who comes to our clinic, said, Dr. Dhlomo, I am sexually active. I need to be assisted. I want to pass my matric before I get pregnant. What can I do? So we need to be very assisting there. But the biggest problem we have, Simphiwe, is that you will want to assume that your 16-year-old girl is not really sexually active, and you deny us information sharing in schools, in high schools, and school governing bodies. That's why I say this is a societal matter. School governing bodies might make a decision that let's have broader and expand some discussions about this issue. When I go, I always say, if I go to a high school and give those teenagers sanitary pads, I am actually saying you will have menses this week or next week. The reason why we have got menses is because there's an egg in your body that never got fertilized by a sperm. But each time, so the commonest cause of no menses on young people is pregnancy. So if you share that information, you are told you are going too much overboard, you are going to be encouraging issues that you are going to. So those are issues that you must be grounded with as school governing bodies, as a society. But we have statistics as well. Our clinics. Teachers see them in schools, and therefore we need to get this into the society. You probably will not be aware, Simphiwe, there's quite a lot of teenage pregnancies that took place around COVID. Those children were at home falling pregnant, not in schools. So there is a problem in society that we must all come together until and unless the society leads and agree that society leads on this process, we're not going to make very much of an impact.
Indeed. Thanks for that, Dr. Dhlomo. Now, Thabiso, what could be the contributing factor to the rise in teenage pregnancy in South Africa? And do you get a sense that we need a new holistic approach, to deal with this problem?
We have a serious challenge around the issues of gender-based violence in the country, Simphiwe. It does not, and it will never make sense for us that why would a 14-year-old child be pregnant? And in many cases, when you engage, you'd realize that it's not the same age group male boy who would have impregnated a 14-year-old. If you look at the statistics around 10 to 14-year-old in our country that are getting pregnant, it is worrying. And as a result, you realize that there's cases of statutory rape there that needs to be correctly reported and dealt with. There's cases of young people that are and cannot be able to give consent at that particular age, but are engaging in sexual activities, which we need to ensure that we increase information levels and ensure that they are sufficiently capacitated to make correct decisions, but they are not through intergenerational relationships where blessers would be targeting these young people and impregnating them. And at the end of the day, nothing happens to those people. Something has to be done in relation to that and the GBV area in that space. But we also cannot shy away from the fact that the country is experiencing a high number of unemployment, thus teenage pregnancy, young people between the ages of 17 that are finishing school. Okay. They do not find themselves in universities and elsewhere. They find themselves unemployed. As a result, there's no much that they find themselves doing, and as such engaging in the same type of relationships that I've spoken about. Our socioeconomic issues in the country has to be attended to, and that would definitely have a positive impact into how the lives of young people turns out in the country.
All right, Thabiso Mokoena and Deputy Minister Sibongiseni Dhlomo, thank you so much for joining us. We do appreciate your time. Well, thank you. That was the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, and LoveLife's National Manager for Healthy Lifestyles, Thabiso Mokoena, speaking to us about the scourge of teenage pregnancy in South Africa.